Like, don't you dare come after me right now.
Good afternoon and welcome to Straight Talk. This is your Drive at 5 and welcome to Monday. Welcome to this beautiful day in the tropics and thank you all so much for tuning in this afternoon. So it is Monday and you know what happens on Monday? It's Medical Mondays and it's brought to you by Health City. So we have the good people from Health City that have come down all the way from the east to share good tidings. Yes, absolutely. In the form of Shamari Scott, who is the Chief Business Officer over there. Good afternoon. Whenever you guys are ready, just hello, guys. Hi.
Hello, Cayman Islands.
Hello. Can I hear you? Can I hear? I can't
Can you hear me?
hear you.
Can you hear me?
I hear you now.
Hello. Check.
You're about to sing the Adele song.
I was about to sing.
the Adele song or the calypso that one.
Maybe a mix of both.
Yeah, of course.
But,
so good afternoon.
You notice I'm here. I was here early, right? And that's because I had to pick up Dr. Vivek, and Dr. Ramnish threatened me that I better be here 15 minutes before.
I was just so happy that you were early.
Yeah, I was waiting on you to the sun was hot outside.
I didn't even know who it was.
I was burning up waiting. But
one
it's all good.
Scandal up in this studio. I didn't even know who it was. I just popped out really quick to grab something from the little restaurant next door because I'd been running late. And I come back and I'm like, who's that standing by the door? I mean, Shamari.
Yes.
Because normally I have to put like a book in the door to
That's me. I'm always right on time. But this time that's what I told Dr. Vivek, you see, this is the punishment for coming early. Wait outside in the hot sun.
You know what it is? It's because these gentlemen are not Caymanian and their watch actually works.
Yeah. Well, I'm always here 1 minute till.
Yeah, so you're always on time,
1 minute too.
On time. But I was thinking, I got 15 minutes. I got to come on.
You were thinking that.
That was quite funny.
Don't worry, I won't make that happen next week. I'll be here 1 minute too.
But I noticed that you still had once scandalized me over the airwaves. So
it's called telling the truth.
We couldn't resist. Absolutely. Well, good afternoon, Shamari, and thank you for coming down. From all the way up there where all the great things are happening at Health City. And thank you all for also sponsoring Medical Mondays, because on Mondays we bring, everything just from Health City, just information, and so that everybody can know what you're doing up there. And I know today we've been introducing people, been having a series for the general public to just, hear about all of the specialists that you have there. So today, tell us who you've brought with us.
So we have a great neurosciences team at Health City, and one section is actually neurology. And with us, we have Dr. Ramnish, who has been with us for 3 years, 4 years? 6 years. You see, I'm trying to shorten it as much. Anybody knows Dr. Ramnish? I'm trying to shorten it as much as possible. He always has the jokes. But 6 years, Dr. Ramnish has actually been with us. Seems shorter than that, but 6 years, I'll accept that. And he has really helped to build the neurosciences team, interventional neurologist that we had mentioned previously in regards to a skill set that's very rare within the Caribbean. If you have a stroke, and a special type of stroke that Dr. Ramnish can go into, he's actually able within a time frame to go in with minimally invasively and pull out the strokes and the clots in order to make sure that you're as good as possible, just as if you never had a stroke previously. So that's why he's very special to us, as well as a host of other things, including jokes. But in order to really fulfill our mandate and our expansion plans, we also have with us Dr. Vivek, who has visited many times, 6 times. He's come in shorter stints, and we were able to rope him in to come in for a much longer time, knowing that we're having our expansion both in Camana Bay as well as upcoming when we have our new facility that's going to be 70,000 square feet. Prior to having both of them explain exactly what areas that they're going to specialize in, Catherine and I, just really excited to announce that as of last week, Monday, we would be open in Camana Bay, the clinic where Picture This used to be. And for those persons that don't know where Picture This is, where Hurley's Media used to be, we're right across from Hurley's Media. And we're open from 11 to 7, Monday through Friday. Extending hours. There's a regular appointments and follow-ups, knowing that people are busy people. I always talk about the fact that my wife always complains that people act like you don't work during the day and everything closes at 5, and on Sundays nothing is open, and on Saturdays everything closes early. So for persons like her who do everything around the house, I must say, I'm the one who is relaxing half of the time while she's running around like a mad woman. From 11 to 7 on Saturday, we're also having our clinic hours, as well as 12 to 4 on Sundays.
Oh, wow. Okay.
So people can actually book and come see their specialists during those hours at Camana Bay.
That's good. That's great. Actually, she's right, because we complain about this all the time. Everything is 9 to 5, Monday through Friday. So yeah, when do you get time to do that stuff? So that's actually really great hours. And obviously, you all are really looking at the changing times in Cayman and trying to accommodate that as well, right?
We're listening to what our patients have said. So previously, they would have told us that East End is really far when it comes to follow-ups, or sometimes when it just needs to be a check-in. So we listened, as well as obviously opening hours for regular time periods to see your physician also becomes challenging. So we're just trying to, our new campaign is within your reach, and everything we're doing, we're just trying to be a little bit closer to your fingertips to make sure that from an access perspective, you have access to the best specialists that we have, obviously, here with us on island. And extending to that, we have, of course, our brothers and sisters in Cayman Brac and Little Cayman. So every Saturday, we're rotating another specialist into Cayman Brac so that you can actually see your specialist and not have to fly early morning, fight traffic, come to Health City for a day and then fight to get back to the airport. We're coming within 10 to 15 minutes of where you live in Cayman Brac as well.
Well, that's nice, because I know Cayman Brac always kind of complains that they get left out. So that's really, really great. And so this new place that you've opened, that's kind of recent, or
that's recent. So okay. That's recent. We would have opened that just after March.
Wow. Okay.
So probably we've had 3 physicians go over. So last 3 weeks we would have had different physicians going. And this week, I think it's Dr. Alwyn, for, if I'm not mistaken, Dr. Alwyn will be there this weekend on Saturday. And it's actually located in the building right across from District Admin. So everybody would know where the Cynical office is located. It's in that same building. First office on the left will be Health City.
All right, sounds good. If you need me to go over, I can go for you guys too. I don't know if you need me to do anything. I'll take the trip.
As long as you bring back Cayman Brac bread, we can work that out.
Well, I can't come back without it.
That's my payment.
If that's what you're asking. Listen, and remember, I don't know, Blackie's Burgers. Okay, we're going to try not to get off track because I don't eat meat too much anymore. So
after you spoke to Stellary?
Because of Stellary, because of the executive health check or the comprehensive health check, which is a really great thing that you're doing over there as well. That's not what we're talking about today, though. We're talking to these gentlemen.
They may actually circle around and say that that's one of the things you should do based on
preventative health.
Yes. All right. So, and I see Shamari going, wink, wink. So you already got your orders.
and now that I think about it, that beautiful face on our 7-year anniversary speaking about the executive health check is none other.
Where is that? I want to see it.
It's in the cinema.
Where can I see it? Oh, really? Oh, dear.
Yes. It's right before your movie. It's the 1 minute
Shouldn't we be able to see these things before the general public sees them?
That's what I always say. That's what I always tell you.
Tiffany roped me into this thing.
Then you might say, no, that's the wrong side. No.
Exactly.
For the benefit of other people knowing.
Come see this now.
Come and save a life at Health City.
I have to go.
Thank you very much.
I have to see it.
We'll send it to you.
You're welcome. Thank you. It was Tiffany that roped me into it. So, and she says, because you talk about
exactly
so much.
About it so much.
I was like, because it's the truth. It was really good. And I was very excited about it. And my friend from CNB, she actually told me about it. So there's a lot of ladies talking about this executive health check. And I'm setting up a couple of appointments for a couple of people in the coming weeks. We wish we could have caught before April 30th. But
talk to me, bro.
Okay. All right. Okay. Yeah. You know people?
Yeah,
okay,
I know people
good.
seeing as you were so gracious to
All
actually
right.
help us out. And,
Yeah. Okay,
definitely.
good. Sounds good. All right, gentlemen, I'm sorry.
No,
I
no.
apologize. Y'all must be used to this,
Yeah.
You must be used to this if you've been in Cayman for a while. I call it a PCM, pause for a Caymanian moment.
Yes, yes.
So it happens all day, okay? So Dr. Vivek, let's say hello to you first because you're not actually the person that's been living here for 6 years.
6, that's it.
Yeah.
Okay, so it's okay, Dr. Ramesh, we can let him
Yeah.
say hello to him first.
Absolutely.
We'll give you Cayman Kind and a Cayman Kind welcome. And so
Thank
now
you, Catherine. Thanks a lot for inviting us.
you're welcome. So you're here now. You're on staff now then. So you're
Yes.
not just visiting.
For
you're
the
here to work.
last 2 months, I've
Okay.
become a part of the neurology staff here.
Okay, all right.
Yeah.
So let's see. Dr. Vivek Philip is a consultant neurologist in our in our Department of Neurology.
So for the last 10 years, I've been working in the parent institution back in Bangalore, to which the Health City is attached to. And since last 2 months, I've come here. Been here 5 or 6 times in the past. Loved the experience. Really enjoyed my stay here. And now, because as you heard, the expansion plans, they needed Dr. Ramesh is doing a remarkable job here. So, but as the things are increasing in number, the patients are increasing, the load is increasing. They wanted 2 of us so that we can, one of us can be in the Health City, one can be in the Kamana Bay Clinic, and that's how we could do things more smoothly. We could perform our duties perfectly.
Okay,
So
okay, great. So because of the expansion, then you kind of need kind of some extra hands then, right? It sounds like.
Yeah.
Okay, great. All right. So what are some of the things that I see some of your special areas of interest are neurocritical care, neuromuscular disorders, movement disorders, neurorehabilitation.
Yeah.
So those are some of your special areas of interest. What are some of the things that you'll be doing here that people can look forward to?
So the main areas of my interests are, one is neurorehabilitation, cognitive neurology, that's and neuromuscular units of the neurology division. So when we talk about neuromuscular, it's basically to do with diseases affecting the nerves like the peripheral neuropathy, and the muscular part is where the muscle disorders which the patients suffer from. And the other disorders are the cognitive neurology, which deals with dementia, cognitive disturbances, especially we're having a large elderly population here.
Right.
Probably we can help out more so that's what I bring to the present department.
Okay, so what are some of the things that you would see, and I like to ask this question because I really do like to make the comparison sometimes, because I think when you are in a different country or different culture, you do see some different things based on a lot of, our lifestyle, what we eat, all different sorts of things. What are some of the things that you kind of see more of a need here that you might not have seen so much? Where you're coming from?
Comparing it with India, the population here, about the elderly population is much higher. About
Really?
8% is what I understand.
Oh, wow. Okay.
Whereas India has a lot of younger population, the majority. So in that way, the problems which we face here are mainly related to the elderly age group.
Okay.
So the balance issues, the peripheral neuropathy issues, the cognitive issues, falls. So those are and strokes. So those are the problems which we come across more here. Whereas back in India, there will be a lot of nutritional, lot of congenital issues, which we see more with the younger population.
Okay.
So those are the things which we come across. So, but the way we deal with them is more or less the same. So yeah.
Okay. And so let's welcome Dr. Ramesh and bring him into the conversation. Good afternoon. Thank you so much for joining us this afternoon on Straight Talk.
Hi, good afternoon. Thank you so much for having me on today.
All right. So now it seems like you have somebody that's going to be able to add some extra hands now. So you're getting quite busy.
Absolutely. We've been pretty busy over the last 6 years. The department has grown quite a bit. So when we had our meeting, we decided we definitely needed to bring someone on who would complement the department and take it forward further. So which is why we thought Dr. Vivek would be the best fit, because he has been here before. He knows about Cayman, the people, etc. And Vivek agreed to join us. So
Okay,
yeah.
all right. So, what are some of the things I think in your clinic then? So, for instance, what are some of the things that somebody might be complaining of? Like, I want to know what does a neurologist do, right?
So what we do is basically deal with all the disorders related to the nervous system. So when we really need to classify things, we say the neurology is basically the central nervous system, and then the peripheral nervous system. So the central nervous, we try to, yeah, okay, sorry. Yeah. So what we do is when a patient comes, we try to figure out whether the problem lies with the central nervous system, whether it's the brain, the spinal cord, or is it in the peripheral nervous system, that is where the nerves comes out of the spinal cord and goes to the limbs or the extremities, or is it a problem where the nerve supplies the muscle? Is that the problem? Okay. So like stroke is a central nervous system problem, like multiple sclerosis is a central nervous system problem, whereas peripheral neuropathy is when the nerves are getting involved due to, there could be many reasons for a peripheral neuropathy like diabetes and many other causes. And then there are the muscle disorders. So that's how we approach it. And that's how we try to classify when a person comes with a neurological disorder, what we are dealing with, what is the axis where the problem lies. And then that's when we start investigating. And that's how the management goes forward.
Okay, so it's basically the nervous system we're talking about, exactly, right? And yeah, it's kind of the messages, right? That
yes, the signals, the messages, yeah.
Okay, and so to get to the bottom of that is to figure out why something isn't working or why it's working this way.
Yes.
Yeah, mm-hmm. I mean, I didn't study this, so I'm just trying to figure it out, right? Yes. And so you did mention strokes, mm-hmm, and so this is something that you probably see, right? Yeah. Quite often.
Yeah,
because it is in an older population. Absolutely, as well.
Yes. Okay. So we do see strokes quite often. The good thing is now there's actually treatment available to help reduce the morbidity which is associated with strokes. So prior to the 1990s, there was not much we could do with a person who was having a stroke. Subsequently, injectable medication came out, which is known as a clot buster, which is given intravenously. And since 2015, we also have what is known as endovascular methods, which, as Shomari was saying, we go minimally invasive, go into the brain, into the artery which is blocked, and open it up. Traditionally, these methods were best up to 6 hours, but now with technology improving, we can even use it in patients up to 24 hours, provided they fit certain criteria. Health City is in the process of procuring this software to help us decide which patients would be candidates for this extended thrombectomy, as it were called.
Okay.
So strokes is something, I mean, it's still one of the leading causes of morbidity and mortality worldwide. And as you said, because of the elderly population, the incidence of stroke is more. But unfortunately, we're even seeing stroke in younger people, right, because of changing lifestyle, etc. So it is something, and it can be quite devastating because it affects your life from that point forward.
Right. So what is the connection to, because this is a very, question that I think a lot of people are interested in. When I happened to do the executive health check, and it was found that my cholesterol was a little on the high side. And so, Stella Ree was the dietitian talking to me about what I should change and what I could eat. And so when I went back after 5 months, it had come down. So it's in a great place. The doctor was so impressed. Shamari was going to tell you that too. The doctor was so impressed. He was like, "What are you eating?" And I was like, "Listen, what's going on?" He was like, "Oh my goodness, look at this. You did this without medication. I think I'm going to try this." I was like, "You mean to tell me I have been, it was that moment where I saw a doctor as a human being, yes, and no longer as a god, because he was like, "I'm going to try this. This is awesome. You are great patients, But what's the connect? And I think that's what was the worry was when your cholesterol is high and the saturated fats and different things, that it can lead to strokes and heart disease. Exactly. What is the connection?
So that's where it all comes down to where medicine is leading. Is known as preventative medicine. So rather than treating the effect, you want to prevent the disease from happening to start with. which is why if you regularly check your lipid profile, your blood pressure, stop smoking, reduce alcohol intake, or what we physicians call as modifiable risk factors, it's better to prevent these kind of events from happening than having to treat it later on. So, which is why when you went in for the health checkup and they told you your lipid profile was high, you were able to control it with your diet. But let's say that when unchecked, then plaque buildup happens within the blood vessels, leading to either cardiac issues, neurological issues, or any other issues of the cardiovascular system.
Okay. Now I'm going to ask you this now, because this is very interesting, and we are in the Caribbean, and so my mom said to me, "Oh, your grandmother used to eat all of that stuff. Ned, she died at 94. You stop worrying yourself about stuff." I want to say that to you, because a lot of people do think like that. Me, unfortunately, fortunately at that time I said, no, I'm not going to think like that. You're telling me something, I'm going to try to do what I can to control that, because I think my 94-year-old great grandmother, she had a lot of different things that were better for her in those days than what's happening now. So I'm not going to hold on to that and think that I'm safe, right? So what would you say to that?
So, your grandmother would have had a much more physically active life than what you lead.
Right.
Obviously without the cars and things like that.
Right.
Also, the kind of meat she would have eaten may not have been as processed, obviously, as what we are exposing our bodies to. And they did have like a balanced diet. Even back in the day, it would not just be meat, it would be meat, fish with greens and everything.
Right.
And also the way the food is prepared, it's deep fried, those kind of things.
Yeah, so the comparison.
The spectrum of diseases have totally changed over time. Like what we used to see earlier, the age groups which got involved in those diseases have changed now when we see that. So we can't have that thought process, because the things are different now. We need to do things differently. And with all the knowledge of all the different studies behind us, then it doesn't make sense not to make the necessary changes.
Okay, yeah. Now, so what made you study this? The question is proposed. What made you study, neurology? What was the interest?
Yeah, for me, I always found the brain as the final frontier, the most amazing organ in the body, and it's always been a mystery. Right now, also, though we have been in it for so many years now, but still, every day is an amazing thing when we really look back how it functions and how delicate it is, but still so resistant to so many environmental things going along well. So it's a very amazing field, and still a long way to go for us to understand it fully. So that's what fascinated me, and we're still in a journey to understand it better, and that's my reason.
For me, when I started, intervention had just come into play, especially in neurology. They were doing a lot of it in cardiac, but in neurology was way, way behind. So it had just started, and then it picked up, and it's showing amazing results, to the extent that previously what you would need an open brain surgery for, you could now do minimally invasive. Also, the other treatments in neurology have also grown by leaps and bounds. Uh, Things like multiple sclerosis now have very good and effective treatments available, and patients are leading practically normal quality of life. So neurology has grown a lot in the last few years, and it's
How closely do you work with someone's general physician? How closely are you connected to the entire body, as opposed to just your area of specialty?
So ours is generally a referral-based practice, so the referral would come from either GP or HSA. So they would have evaluated the patient as a whole and referred for neurological opinion regarding a certain thing which they felt was raising a red flag. So there is a close connection between the GP, the Georgetown Hospital, and us when we are evaluating a patient.
Okay, so you mentioned red flag. What are some sort of like red flags?
So it can be something as simple as normal headaches, like if there's an increase in the frequency or severity of the headache, or change in the normal pattern which the patient is experiencing with regards to the headache, or what we call as a thunderclap headache, things like that. So if a physician picks that up, or warning signs of even a stroke, like sudden onset of difficulty in speaking or weakness which recovers, generally patients would go to their GP first, and then the GP would refer for evaluation. So these are kind of red flags which the physician would pick up and then refer the patient on for an evaluation.
Okay. And an evaluation would involve what?
So in neurology, it starts with a detailed history, physical examination, followed by targeted investigation. So if you feel the person is having a stroke, you would order an MRI of the brain. If you feel he's having multiple sclerosis, again, an MRI of the brain with possibly a spinal tap, some nerve tests would be done. If, as Dr. Vivek said, you suspect a peripheral neuropathy, it would be a nerve conduction test. Seizures would be an EEG, or what we call as an electroencephalogram. So depending on what the patient presents with and the history, examination, and then the testing would be decided.
Okay. All right. So you'd say that you work very close then with a GP.
Yes.
Yeah.
And
Okay.
the patient generally continues follow-up with the GP once the diagnosis is established and a treatment plan is formed. So,
Okay. Okay. And so how closely will you, Dr. Ramnesh, work with Dr. Vivek then in terms of your patients and the patient care?
So yeah, it would be very, very closely. So what we're trying to do is Dr. Vivek would take over the electrophysiology side of neurology. So that involves EEGs, EMGs, nerve conductions. I would still be with the interventional part and possibly, and also with the multiple sclerosis group, I would still be following up with those. And yeah, that's.
And we'll need the inputs. Like when I'm doing the electrophysiology part, it's always important for us to know what is the background history. So even if he refers it to me, I need to know more details of it. And then once I find something in it, I get back to him. This is what I think. This is where we need to go ahead. This is the test we need to do. So it's all basically on where the problem lies in the axis of the nervous system. And then we need to coordinate for the further testing. So, and we both have worked together in India. So that way we know each other very well. And so that helps us to have a good understanding.
Right. Yeah. So you kind of know each other's language a little bit.
Yes.
So you work actually, Dr. Ramnesh, and will be based in Health City,
No, so
or it's
we'll be rotating once a week. I mean, not once a week, for a full week. So like this week I'm in Kamana Bay, the week after this he would be, and that way in rotation.
Okay.
And once in 6 weeks, one of us would go down to Cayman Brack for the clinic there.
Oh, okay. Okay. So
it's just about helping with capacity, right?
Okay.
So at the end of the day, all of our physicians belong to the Health City ecosystem, and there will be a rotation of physicians throughout Kamana Bay as well as in East End. If you need a procedure, you're gonna have to come up to East End, but just making it within your reach, you can come get your first consult at Kamana Bay and or follow-ups that don't need the type of equipment that we have up at East End Diagnostics we can do here. So it's really just to make it more convenient, but the expertise will be rotating throughout Cayman Brack, Grand Cayman, East End, and as well as Kamana Bay.
okay, and that's great.
And the management also did not want any gap in emergency care.
Right.
So like let's say I was in Cayman Brack and there was an acute neurological emergency here, there would be no one to look after that patient. Or even if it's one of our established patients, then there would be no one to look after that patient. So in this way, there will be 24/7 coverage.
Yeah. Well, I think that's great because, sometimes when you see a particular person and, like in a clinic setting, sometimes you'd like to see that person again sometimes.
Yes.
So it's kind of good with the whole rotation. So it's not just that, that person is not available to you, just because with patients, right, we're humans, so we kind of like to know that the same person is picking up where they left off, and then you guys are communicating. So that's really good. Thank you all so much for joining me this afternoon. We will continue the conversation. This is your Straight Talk Drive at 5 show. Catherine Tyson, your host, and we're talking to Health City. The people from Health City, they come on down on Mondays. It's Medical Mondays, brought to you by Health City. And today we are talking with Dr. Vivek and Dr. Ramnesh, who are consultant neurologists, right? As well as Shamari Scott, who's the chief business officer, and he's ready to correct me if I had said anything wrong. So, because that's what we got to do. We got to keep each other on track, right? So you can always join in on the conversation, 943-3700. If you have a question, we'd love to hear from you. But stay tuned. We'll be back with more Straight Talk.
And so many people are viewing you now.
You didn't send to your
And welcome back to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host. Thank you so much for joining me this afternoon. It is Medical Mondays, and it's brought to you by Health City. We are in the studio this afternoon with Shamari Scott, who's the Chief Business Officer at Health City. Just head cook, bottle washer, you name it, he's it. He's gonna do surgery soon. I'm telling you.
I'm just
brilliant.
Waiting, I'm just waiting for you to come so that
the man is brilliant.
I can have my first time
so you can get a break.
Yes.
I'm telling you. Listen, Shamar, I'm not joking here. I am not joking when I say that. Like, doctors, listen, if he watches you do a procedure, he is going to be able to tell us exactly what you did.
Yeah.
He's that good.
No,
he's brilliant. No, for real. We're not just saying that.
Whenever you're ready to have your first surgery, I will come in and assist.
Well, no, I didn't say that.
I will come in and assist Dr. Vivek and or Dr. Ramnish.
Or heart surgery, whichever one it is.
Yeah.
Whatever you're coming for, I'll make sure to assist.
I just know if he's watching, he knows what's going on.
No, and he gets our taglines very well.
It's a compliment.
Time is brain, time is muscle.
Yeah.
Yes.
So sometimes I get mixed up a little bit, but
That's
we don't want to know.
He wants to think time is brain is number one, right?
We don't want to know what happens when we mix it up, right? For sure. You're listening to the voices of Dr. Ramnesh and Dr. Vivek, because Dr. Vivek is the quieter one, it seems like.
No, he's not. No.
Dr. Ramnesh, he's a little rowdy.
I'm gonna get...
Starting with an R, he's a little rowdy. But he's been here longer, you're like that new kid that comes in, knows nobody, and so quiet. Within like an hour, he's like destroying the place. Are you?
Wait,
no.
See, yes, I'll be in India, different person.
Like, that's Dr. Vivek? You mean the one that? No, come on. Exactly. Well, we're talking about a neurologist and interventional neurology that's happening at Health City, as well as the new locations. Shamari, just remind the listeners of the new locations and some of the good things that's happened in the last couple of months.
Definitely. So as we like to say, we're within your reach. So we developed Camana Bay. It's a clinic right there where Picture This used to be, and or if you don't know where Picture This used to be, Hurley's Media, where it was in Camana Bay. It's directly across from Hurley's Media, right in that office space. We're open from 11 to 7. Monday through Friday, and an additional prize, our 7-year anniversary, and we always give you new gifts. So the new gift will be Saturday, 11 till 7, right there at Camana Bay, as well as Sunday, 12 to 4 p.m. So for all you people that are too busy during the week to be able to get to see the doctor, you have no excuses. All you men that will say, no, I have to work, I can't get there, guess what? On Saturday from 11 to 7 and Sunday 12 to 4. No excuses from here on out.
Yeah, and you actually have people that answer the phone, so that's always good.
So it's 640-4040
4040
or info@healthcity.ky. So we have the same phone number, same email, so you don't have to remember anything else. Just call and say that you would like to go to Camana Bay and or whatever is most convenient. We'll have a conversation and see what works best for you.
No, there you go. So I'll just give you a little background on the doctors in the studio this afternoon. Dr. Ramnesh, so completed his specialty training in neurology and then did a fellowship in stroke and interventional neurology. We'll talk about that a little bit, as well as you were involved in the care of various patients having neurological disorders such as migraines, epilepsy, peripheral neuropathies, stroke patients requiring rehabilitation, and some of these words that I don't know, so I'm just skipping over them. Multiple sclerosis and movement disorders. Also, medical, like neurology emergencies, especially such as strokes, as well as working with acute ischemic strokes. Yeah. So talk to us a little bit about what all that means anyway.
Okay. So we'll start with stroke first. Stroke, as I said earlier, is one of the major causes of morbidity and mortality. It's generally thought to affect people in the elderly age group, but now we see it more and more in people of the younger age group. Before, there was not much treatment available for stroke, but now we can reverse most of the effects of a stroke if the patient reaches us in time.
Okay.
Broadly speaking, stroke is divided into two types. One is ischemic, where the blood vessel gets blocked. The other is hemorrhagic, where there's a rupture of the blood vessel and bleeding into the brain.
Okay.
The acute stroke management is generally targeted towards ischemic stroke, which accounts for about 80% of all strokes. In this method, what we do is we go and open the blood vessel and reperfuse the area which is not getting enough blood. For the people, it is very, very important to recognize the signs and symptoms of a stroke so that they can get medical attention urgently. The easiest way to remember that is by remembering the anagram B FAST.
Okay.
What that basically means is, so B stands for balance, if the patient suddenly has any difficulty in maintaining balance.
Okay.
E stands for eyes, whether they're having double vision or a bystander notices his eyes are kind of skewed. F stands for face, so you ask the patient to smile, one side of his face will droop. A stands for arm, you put the arms out of the patient in front of him, one side will drop. S stands for speech, which could be difficulty in speaking or comprehending what other people are telling him. And T stands for time to call 911.
Okay.
Or get urgent medical attention, because the sooner you reach to a medical facility, the faster the stroke code can be activated and the patient can be either given IV thrombolysis or mechanical thrombectomy. But in stroke, time is brain. Every second, millions of neurons die. So the faster we reperfuse the area, the better the outcomes are.
Okay. All right. So be fast.
Be fast.
Okay. Now, I'm also seeing you've been involved in over 700 neurointerventional and diagnostic procedures such as carotid intracranial and carotid artery stenting, right? As well as coiling for intracranial aneurysms, intracranial stenting, embolization for intracranial and spinal vascular malformations, and endovascular treatment in acute ischemic stroke. Yeah. So you're involved in actually kind of putting it right or working on that part of it. Yes.
Yeah. So technology has improved on a lot of surgeries, a lot of interventions which would need open brain surgery can now be done minimally invasive. So now, unless there's some absolute contraindication, most aneurysms. So an aneurysm is a bulging in the blood vessel wall, which is a danger potential of rupturing and bleeding into the brain. Most of these can be treated endovascularly. We either put a stent or we put platinum coils within the aneurysm to block it off. Other things like arteriovenous malformations or an abnormal connection between the arteries and veins within the brain can also be treated endovascularly. Sometimes we work along with our neurosurgery colleagues, and let's say they're operating a highly vascular brain tumor or a tumor which has a very high blood supply. To bring down the risk of bleeding during the operation, we go and first block the arteries which are feeding the tumor. The surgeon can then go in and remove the tumor safer than what he would have otherwise.
Okay. All right. So now, can I ask you, when we hear, because we just people, we don't know what's happening, right? So we'll hear that someone goes in for a procedure, and while they're in the operation or in surgery, they'll have a stroke. Can you speak to that in any way? Like, what happens?
So that it does not commonly happen, but it can happen. So generally, before any patient undergoes an elective procedure, they are screened by what we call as a pre-anesthesia clearance, a pre-anesthesia checkup. They go through an entire checklist, which would stratify the patient whether he's at high risk for an intraprocedural stroke happening or a vascular event happening involving the heart. The patients who are generally at a slightly higher risk would be elderly patients who have diseases of the carotids or the blood vessels supplying the brain.
Okay.
Patients who have cardiovascular disease, which could be a poor pumping of the heart muscles, or even what is known as an arrhythmia or atrial fibrillation, as it's commonly known, which predisposes these patients to throw clots. So these patients would then be risk stratified by the PAC clinic or the anesthesia clinic, and the risk we would try to reduce the risk. So let's say the patient has a risk of throwing a clot, we would possibly put him on blood thinners before the surgery and start it as soon as the surgery is completed. If he has a carotid artery stenosis, we would try to quantify how severe it is and whether that needs to be dealt with before he undergoes the other surgery.
Okay. All right. Okay. So we're going to talk to you, gentlemen, a little bit about some symptoms and those things as well. Let's talk just a little bit. Dr. Vivek completed his specialty training in neurology. Prior to specialization, you completed your MBBS and MD in internal medicine, and also spent 4 years serving patients in rural India prior to undertaking this specialization.
Yeah.
Yeah. So you were working primarily with just in general, like general practitioner as well?
So what happens is like I did it from a Christian medical institution. So what happens is after you finish your basic education, we are sent to these small rural centers where there are not too many facilities, or where the doctors are usually not willing to go. But so we go to those centers, and that's where we serve for about 2 years, 3 years. It's like a kind of a contract which we have with the church.
Okay.
And we do that. So after my MBBS, I worked in 2 peripheral centers like that. And then after my internal medicine, I worked again for a few years there.
Okay. What does MBBS stand for?
Bachelor of Medicine, Bachelor of Surgery.
Okay. All right. So experience in a wide spectrum of neurological ailments, which includes strokes as well as Dr. Ramnish. So you guys work hand in hand, yeah? Epilepsy, seizure disorders, multiple sclerosis, dementia, neuromuscular junction disorders, nerve and muscle disorders, and neurocritical care. Let's talk a little bit about some, interventions, like stroke interventions, as well as symptoms of stroke, as well as multiple sclerosis. I think we touched a little bit on stroke symptoms, but let's just talk a little bit about what people can look out for.
So when it comes to multiple sclerosis, the symptoms which you usually see are the ones which usually, the multiple sclerosis is basically a demyelinating disease which affects your central nervous system, either the brain or the eyes or the spinal cord. So the symptoms depends upon where the demyelination has occurred. So one of the stereotypical, it has a stereotypical nature to the symptoms. One is either they have the demyelination affecting the optic nerve, so they might present with a blurring of vision, which is like a painful blurring of vision which happens over 2-3 days, might progress to a near blindness, and that's how they come to us. That's one of the symptoms. Sometimes it can be just a buzz in the one side of the body, either the right or the left. And third symptom could be that they could be very ataxic, or they would have a lot of imbalance while walking. So these are the common symptoms with which a multiple sclerosis person can present with.
Okay.
So it's very vital, very important that we pick it up early. We understand that, especially in this part of the world, it is quite common, and it's much more severe than what we see back in India. So here it's much more common. So here, even a small symptom which comes transiently, many times it might just come in the first instance, come and go within a few days, and they might not realize it's important. But if it is like on one side of the body, or if it is having an effect on your eyes, or if it is affecting your balance, it's always better to come and check it with the neurologist. Okay. So that's how usually the multiple sclerosis presents, and it's always better that we pick it up early so that we treat it early before the disability sets in.
Okay. Now, also, I know I have a friend who has MS, and sometimes she's in a lot of pain, and sometimes she's not. So it kind of depends on, I don't know if it's the weather or what it is, but what's happening. But I know like that's a big thing for her. Just kind of feeling like very weak sometimes, and then sometimes not feeling that way. So it's degenerative, but it's kind of just very interesting that some days she's better than other days. Yeah. So, and there's no explanation for that, I guess.
So it's basically what is happening is the nerve sheath it just goes off, certain patches of it. Some days the signal, it also depends upon your environment, like a hot shower can worsen it. So those just a fever, So those are things which can make you suddenly weak. The signals might not go through, and then you might develop a weakness. But those are transient ones. Those won't be considered. If it lasts more than 24 hours, then we consider it as a relapse or an episode of MS. But sometimes it might just come with a small episode of fever, might be there for a few hours, might just present as pain or weakness, and might subside by the end of the day. So it is quite common, those symptoms, and it's basically because of the signals going from the central nervous system to the peripheral.
Okay, so in terms of headache, now you also work with migraines too.
Yes.
Right, and those that varies across the board. Each person's migraine could be very, very different. Yeah.
Yeah.
Okay.
So migraine is it's been now what the concept is nowadays. It's mainly called as primary headaches or secondary headaches, because many times what we are seeing is there is an overlap of migraine and tension type headache. Those both come under primary headaches, where it could be just stress related, or it could be because of the triggers like a migraine person gets, like when they go out in the sun and things like that. So there is no point. What we feel is differentiating between the two, and we try to club it into a primary headache. And the secondary headaches are the ones where the scan picks up something. It is due to either an aneurysm or a tumor. So the treatment, because if you just try to separate out migraine versus tension type headache, many times you're not too sure, because there's always overlap. Because of the migraine headaches, you get depressed. So those kind of overlap is there. So this is how when we approach a patient, we look for, as Dr. Ramesh was saying, red flags. If there are red flags, most likely we are dealing with a secondary type of headache. Then we go for an imaging immediately. But if it is a routine kind of a migraine or a stress-related headache, we try with medications first and see how it works.
Okay, I have a question. Also, Dr. Ramesh, I can also ask you in terms of dementia. And I think you both work with that, right?
Yes.
So in terms of like a dementia patient, and the concern sometimes is that they're feeling, right, like you could hurt, like they could be hurt and not even know that they got hurt. So is that they're not feeling the pain? Is that kind of has to do with the nerves as well?
So dementia usually not much of an issue with the feeling part, the sensory part. So it's not like the person is comatose or something. That's where we are not sure whether they are feeling the pain or not. But dementia, it's more like the cognitive functions, whether they slowly go downhill in the alertness, in the orientation. And that's the time when the family members are not sure whether they are understanding that they are being isolated. That's some of the guilt feelings which the caretakers have.
Right.
But regarding pain, I don't think that's an issue when it comes to dementia.
Okay. It might be more that they forgot, like how it happened or something like that.
Exactly.
Yeah. So that would be more with dementia and Alzheimer's. Yeah.
Yeah.
Now I know I'm also reading that you, Dr. Vivek, was running a neurophysiology lab.
Yeah.
And that's kind of where you're coming from right now,
Yes,
right?
yes.
And that's we have that here.
Yes.
Okay, let's talk about that.
Yeah, so we have a good functioning electrophysiological lab that's been going on since 2016. So I just come to complement it, just to work with it. And as the work was getting busier for Dr. Ramesh, so somebody needs to oversee the procedures which are being done. We have an electrophysiology technician, so he takes care of doing the procedure, but there are certain parts which we need to oversee, or we have to do it. So it basically, what we do is we do the EEG, the electroencephalogram, which is looking into different kinds of epileptic disorders, or with the people who are in coma, or people who are having altered sensorium. They are brought to the hospital. Suddenly they became disoriented, confused. Those are the times when the EEG helps you.
Okay.
And the people in ICUs, on ventilators, when they cannot, when you ask them and they cannot respond because of multiple medications, the EEG helps us to know whether the person is in altered sensorium. Is it because of the medication or because of the disease process? Okay. So that gives us a good feedback. So the EEG is something which we do in OPDs and even in the ICUs. Okay. So that's really helpful. And the other one is the nerve conduction and the EMGs, which we do. So the nerve conduction is basically to rule out any peripheral nerve related disorders. So when we are doing it, when we are evaluating a peripheral neuropathy, it's not only a clinical evaluation. Clinical evaluation is very important, but when it comes to find out what kind of nerve fibers are getting involved, that is a good idea we can get through the nerve conduction test.
Okay.
So, and what kind of disorder is causing the nerve to get damaged, that also some information we get from the nerve conduction test. So the whole investigation process changes based on what we find in the nerve conduction study. So it's also very vital, very important component of our services.
Okay.
So that's the two. And the third is the EMG, which we poke small needles into the muscles just to see how the muscles are. Is it healthy? Is it denervated? And then again, we get an idea of, we're looking at a muscle disorder where it's going to progress further, or is it due to some drugs? The person is weak. So that's how the ENMG lab helps us.
Okay. I just got a question from a listener. If Parkinson's, if you're working with Parkinson's, if that has any connection?
Yes.
Okay.
Yeah, we do.
Yeah. So what and what are some of the symptoms of Parkinson's? Because they're just kind of curious about, they might have it, so they want to know some of the symptoms.
The most common symptom patients would come in is with a new onset tremor, which generally affects one side of the body. Other things are like slowness in activities of daily living. So how he would take longer to walk on the distance than what he normally would. Things like buttoning, unbuttoning his shirt can become difficult. There's also a change in the posture where the patient can become more stooped.
Okay.
These are the most common symptoms which bring a patient with typical Parkinson's to the attention of the neurologist. There are also some atypical versions of Parkinson's which may cause patients to be predisposed to falling very frequently and things like that. So, but the most typical form which we see is tremors, slowness in activity, change in posture. So the volume of the voice of the patient comes down, those kind of things.
Oh, okay. And when you say tremors, like what? Like, for instance?
So the Parkinson's tremor is typically a resting tremor. So when the patient is at rest, his hand would start shaking.
Okay.
You typically see this when they're sitting comfortably to watch TV or something like that. The character of the tremor is generally known as pin rolling, where they keep doing this kind of movement. But it's generally a new onset of tremor which first brings the patient to the physician. But again, all tremors are not Parkinson's.
Right.
So it's usually one-sided, and it's not while doing the task. Most of the people, when they're holding the mobile or a glass of water, they might be shaking. So that's not the classical one. The classical one is when you're totally at rest and you get those tremors. That's the time when you start thinking it is possible.
And so what should they do then? They should come in?
Yes. So the first thing is to establish the diagnosis. Parkinson's is mainly a clinical diagnosis. Whereby you take the history, clinical examination, that gives you most of the answers. And then there's a wide variety of medications now available for the treatment of Parkinson's to slow down its progression as well as improve the quality of life of the patient. And in very, very refractory cases, there's even surgery which is available, which is known as deep brain stimulation, where electrodes are placed in to improve the quality of life. But that's reserved for very selected cases who are not doing well on medication.
Okay. So so they should get tested. They should, and establish that first, and then you can kind of work from their individual standpoint. Yeah.
So there's a mnemonic for that also. Like it's called TRAP-FF. So T is for tremor. So R is for the stiffness, rigidity we call it. A is for the akinesia, where there is very slow they become. And P is where the posture goes off. So that's trap.
Right, so
and then there is F for freezing. While walking, they just get stuck.
Okay.
So that's just for them to remember.
Okay. All right. So trap, to look out for those things. Now, Shamar, I have a question for you then.
Yes, ma'am.
If there's someone who is overseas and would like to get treatment at Health City in this this COVID time that we're in, what would be the procedure?
Right. So, I mean, right now we're limited in what can potentially come in. However, same thing. They just contact 640-4040 or info@healthcity.ky. And we have people, depending on which area they are, we have different people that would respond to them to help them walk through the different scenarios. And even if they aren't able to come to us, we would be able to help them to get to a place that could take them at this point in time.
Okay, so that meaning if they're overseas, you can
we've been managing, because we had many relationships with many different islands, Central America, companies in the U.S. as well as out of Canada. So we've been managing all of that over this difficult year and many months to make sure they get the help they need. Everybody's waiting for borders to open, but obviously we need to be safe first. So in limited scenarios, there's a potential, but outside of that, we'll help them as much as we can.
Okay, all right. So they just need to call.
Correct.
Okay.
Or email.
Okay, great. All right. So yeah, thank you, gentlemen, for joining me this afternoon. So kind of, what are you up to now then? What are you up to? Like, what are you doing tomorrow? What do you do this week? Like, what does your time look like? When can people find you?
So Monday to Saturday,
they're all excited about coming out and getting themselves checked out, so they want to know where they can find you.
So between me and Dr. Vivek, Kamana Bay and the Eastern branch would be pretty much all routine working days. Emergency services, of course, only in the Eastern facility, whether it's stroke or whatever else, that is open 24/7 and they will be seen. But the clinic runs pretty much Monday to Saturday, either at Eastern or in Kamana Bay.
Okay, all right. I mean, Shamari, this is a popular duo here, because I've been getting people interested and they want to know where they can find them.
Where they can find when and where, right?
When and where, exactly. And we don't usually have that. So you can tell the young ones when you go. I'm joking. Tell them they got the 1,000 views, but you got the calls.
640-4040 info@healthcity.ky. Just call our email and we'll be able to make sure the best option available, that we have it for our patients.
Absolutely. And of course, that executive health check is not going to hurt.
No,
that's going to be a good thing.
That's one of the areas that we always talk about. Prevention is better than cure.
Right.
And for the most part, when you catch things early with the marvels of modern day medicine and physicians like the two we have, usually you can avail yourself of services that will help you to get back to 100%, and if not 100%, as close as possible.
Right, and at least be able to manage it and live the best that that you can live.
And if you catch it early, then that definitely is a possibility.
Yeah, and that's always great. And I love these conversations on Monday because of the hope I feel the hope that it represents. I love Monday anyway because I don't have to do too much. You bring in these amazing people and you sit there and you guys just talk to us about what's happening, but also just to know that we have that kind of resource in our community and this little small place that you can barely see on the map, and we have like this level of expertise. I'm very happy about that. And also just I think the hope that, if there's anything going on, you're not alone. You got a place that you can go and check yourself out, and you have all the people that are there to help you. So I love that, and I love facilitating that. Thank you so much.
Thank you
for joining me this afternoon, Dr. Vivek. Welcome again.
Thank you once again.
And now you're home, okay? And Dr. Ramnish as well. Ramnish as well. Welcome. For your 6 years being here. Don't go anywhere. Stay. And Shamari, thank you for bringing the gentleman down.
Always. I'll be back next week. 1 minute till 5. Yep.
Yeah. Well, just in case I step out. Just enjoy the vitamin D.
He was trying to get shade behind a small pillar. So
he cannot get shade. He's not.
Hey, my face was covered. That's all that's needed.
Anyway, thank you all so much for joining me this afternoon, for the listeners as well. And you guys have a great evening, and I'll talk with you again tomorrow. It will be Hot Topics Tuesday. This is your Straight Talk Drive at 5 show. Catherine Tyson, your host. Have a great evening.
Thank you. So you got a lot of calls? You tell them.
Let me